Today we are talking about chiropractic versus physical therapy. What are the differences? Do all the chiros hate all the PTs? Do all the PTs hate the chiros? Where should you go for your injuries? And just kind of going to clear the air about some differences between the two professions. Okay, so I'll start by saying this. There's a lot of different, let's say, attitudes in either camp of the PTs and the chiros. Some chiros believe that adjusting the spine, doing a manipulation of the spine can cure disease, can do all these different things. And then there's a whole separate subset of chiropractors that know that adjusting the spine, can alleviate some pressure, some tension, increase some range of motion. There's some neurological, relaxation, endorphin effects of the adjustment, but that is not the end-all be-all in terms of, health and wellness and musculoskeletal care. Okay, so there's kind of those camps within the chiropractic world. I know within the physical therapy world, again, I'm not a physical therapist, I'm a chiropractor, but I know within the physical therapy world, there's a lot of debate over, what's the best technique? Is it McKenzie, Mulligan, XYZ technique, ultrasound versus, manual therapy, ART, all these different, acronyms and things like that. And physical therapy and chiropractic, I think, have a ton in common, and we'll go through that kind of as we go here. But traditionally speaking, chiropractic the degree is a chiropractic physician, essentially, in Illinois. Now, all that means is, we're a doctor. We don't necessarily need we don't need a referral. We have direct portal access to patients off the street, provided you're in network with their insurance or they want to pay, cash, whatever they choose to do there. But essentially, you don't need a referral from another physician in order to see a chiropractor. In many cases, some cases still require it. In physical therapy, traditionally, you would need a referral, but I know more recently that a lot of times PTs are gaining direct portal access to patients, and I don't know if there's any stipulations between how many visits they can see before they need to have a diagnosis or see a physician for that, but that was typically the main difference. Now, obviously, you go into an office that's a physical therapist or a chiropractor, they're going to have their specialty in terms of how they treat your condition. And that's going to be kind of your main difference, I would say, is how you get treated for a similar condition. Okay, and that's kind of a shame. I know there's a lot of protocols out there that say, okay, for a cervical spine injury, you should mobilize this way, you should strengthen this way, and it's going to take 3 to 4 weeks or whatever. I'm just making up an example. Now, I think a lot of chiros and a lot of PTs follow a lot of those. A lot of them don't, and they kind of go off on their own and they try to do their own thing based off their experience. But I think one thing we need to keep in mind is evidence-based practice versus other practice, we'll just call it. I'm going to focus more on the evidence-based side of things. It's kind of a three-pronged approach. It's patient preference, it's what the research says, and it's the doctor's experience. Okay, so the doctor has to put all those things together to create an evidence-based approach for the patient. Okay, whether they're a physical therapist or a chiropractor. If you're evidence-based, that's the three-pronged approach that you're taking. Okay, so truthfully, I always tell people, whether you came to me, the chiropractor, or this guy down the street, physical therapist, what we do should probably look pretty darn similar if we're doing the right things, in keeping up with that three-pronged approach of evidence and patient preference and doctor experience. Okay, unfortunately, that's not always the case. But again, I always tell people, if we've got our two continuums, we got our chiropractors here and our physical therapists here, the best ones in each profession are kind of heading towards similar ways of treating people. Okay, so it's an active approach. Maybe we're doing a little bit of hands-on, maybe it's some muscle stripping, maybe it's some adjustments, whatever it happens to be, some dry needling, blood flow restriction, stuff that we really like. Whatever the latest research says is indicated in that situation. But the biggest focus there is getting the patient active, loading those tissues that we need to load properly, and really just getting that person to live a healthy lifestyle and add in a loading regimen that helps them with their condition is kind of the end-all be-all in terms of rehab in either situation, chiro or PT. All right, there's people that are kind of more on the fringes of both professions that will say, oh, this technique is the one, end-all be-all for neck pain or back pain or whatever. And then the chiros over here are saying, oh, adjusting is the only thing you ever need. And to be honest with you, I think a lot of the people in the middle are more so where we kind of associate with, and a lot of other physical therapists kind of get along much better with each other as well as with chiros when they adopt that mindset of active care, not too much of a provider reliance, things like that. So I think that's important to understand. Now, in terms of where you should go for your injury, I can't really tell you, you need to go to a chiropractor only for that injury, or you need to go to a physical therapist only for that injury. I personally tell people, because a lot of them are not sure, I say, you know what, if you're having musculoskeletal pain and you're not really sure where to go, and you know me, you like me, whatever, come to me, and I'd be happy to, if I'm not the person for you, I'll be happy to refer you to someone who is more, is going to be better at treating that condition than I am, if that's the case. That being said, we employ physical therapists, and we think physical therapy is awesome. Honestly, I always tell people, like, probably 98, 99% of what I do is what a physical therapist would do, all right? We're going to find an entry point to load, and we're going to increase the load tolerance of that tissue to then reduce pain, okay? So we're going to improve the function of that area to reduce pain, okay? Exactly what a physical therapist can do, exactly what I'm going to do. Many physical therapists use adjustments or manipulations just like chiropractors do, and many chiropractors use physical therapy implements just like the PTs do. So like I said, a lot of those professions are heading towards one another. Whether or not they ever merge into one, I don't know. But at the end of the day, because our philosophies are so similar, especially like with Synaptyx and with other traditional physical therapy models, again, I don't think it's necessary for all this like headbutting to be going on. And so I kind of wanted to just sort of clear the air, tell you the differences between the two, the similarities, and sort of what you should be looking for in a chiro or a PT. Obviously, people are going to have things that they kind of lean towards to say, like, yeah, I really like getting adjusted every couple of weeks. It feels nice. Or I really like going to my PT. He's really good with his hands. He works on my shoulder or whatever. And those previous, patient experiences are important to consider. But at the end of the day, a lot of what we do is very similar, okay? So you should choose a company or a location based off your specific goals. So if the company wants to get you back to doing what you like doing, walking, playing with your kids, playing football, running, whatever it happens to be, then that should be a company you kind of roll with. If you walk in and they immediately try to sign you up for 1,000 visits and say, oh, it's gonna be $10,000 and blah, 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 you gotta come in forever and all this stuff, personally, that's a little bit of a red flag for me, whether it's PT or chiro, okay? And so those are some things you should be keeping, in your mind, sort of. I think we'll probably do another video about like how to choose a PT, how to choose a chiro. I think those will be good videos. But yeah, I just wanted to kind of go over the differences between the two and answer any questions you guys might have. If you guys have additional questions about this stuff, shoot us a DM, shoot us a message. We'd be happy to, get in touch with you and answer any questions you guys might have. But hopefully this kind of puts to rest some of the PT chiro headbutting, okay? Thanks, guys. We'll see you in the next one.